cases. Are you ready?
Yes.
Yes, Doctor.
Yes, Doctor.
First group to present.
I will be the patient mom
Okay.
for the first case.
Okay, who will be the examinee?
For the doctor, I do not know who want to volunteer.
Oh, is it volunteer or assigned? Okay, good. This is a good achievement. If we make it completely blind, it is better. So, should I choose or someone
Doctor.
needs to raise his hand?
Doctor, just pick anyone, Doctor.
I need someone who didn't present it before. Let me.
Doctor, I will prepare for the second case.
Okay, so let me be out of of this time. Okay. Sharifa, I think you presented before for me. Fatin?
Ready.
Fatin also? Who didn't present? Nur Salwa?
Yes, Doctor.
Did you present with me before or not, Salwa?
Not yet.
Okay, your internet is okay?
Okay, inshallah.
Okay, so you have a nice mom now, Nabila. I need to spend with her 20 minutes gathering the history, and I will discuss both you and Nabila after finish, and then we are going to present some Uski and holding a good job. Sorry.
I will also present the OSCE for this case.
Yes. At the end, inshallah, we hope we can finish before 1 hour because we have another session. Okay.
Okay. Inshallah.
And let us start by Al-Kitab. Hoping everyone can turn off his microphone so we.
Can I start now?
Okay, Salwa, you can start.
Assalamualaikum Puan.
Waalaikumsalam.
Okay. What is your child name?
Okay, as you can see, this my child, my child name is Kisha. Okay, Kisha is 5 years old. As you can see, now I'm taking her in the emergency because of there is a body swelling. I think it's about 3 days before.
Where how the swelling start? Where is the swelling?
Okay, as 3 days before, I noticed there is a face bloated and puff up when she wake up from sleep. It's about 7 a.m. like that. And then I see the puffiness around the eyes. First that begin at the eyes, around the eyes. Then it spread to the whole part of her face. Then I found out that the abdomen also distended. There's like swelling, and then the leg also swell for the both side.
It's that 3 days ago. And then other than that, Did she appear lethargy?
Actually, for the 5 days ago, she has a fever, and it was a sudden. And but there is no documented temperature at the home. I brought her to the clinic, and the clinic gave syrup, and the fever is relief. So, but because of the fever, my child cannot has a poor appetite, but she's still active. I think there is no lethargy.
Oh,
There's
okay.
a poor appetite.
So, did she has difficulty in urinate?
Oh yes. I found out that for this morning, usually she will urinate for about 6 to 7 times, but for today, before this going to the emergency, uh, she just urinate 2 times. Uh, at the night before and this morning, and she also complained. Uh, she also complained the urination is not like usual, meaning just a little. She just urinate a little bit, and I think that's all.
Uh,
I think she also said that uh, uh, the the urine is like a frothy.
oh, frothy urine.
I
Uh,
think so.
uh, is there any blood in the urine?
She did not. I asked her, but there is no blood.
Did she has any painful urination?
Oh no, she has no complaint of any pain.
Uh, did she has suprapubic pain or any abdominal pain?
Mm, there is no pain, but I saw that the abdomen is like distended. No pain on the abdomen.
Okay. Mm, did she has rapid breathing, shortness of breath?
No. She has no complaint about the shortness of breath, and I think she just breathe like a normal person, like usual.
Mm, during the when 5 days ago, you said that she has a fever.
Mm.
Um, did she has a sore throat?
Uh, okay. Then for the fever, she has no sore throat, no coughing, no runny nose, just a fever.
Uh,
I felt warm when I touched her body.
oh, for right now, did she still has fever?
No. I
Oh,
think the fever is already resolved because we go to the clinic and get the syrup to her to drink.
okay. Mm, did she has any skin rash? Any rashes on her body?
No, I do not find any rashes on her body.
Oh, okay. Did she say that she has joint pain or joint swelling?
No, I don't think so because she did not complain any pain. Just I saw the swelling.
Mm, did she has chest pain,
No, chest pain.
palpitation, palpitation?
Palpitation. No.
Did she so she's still active girl? She can
Yes.
activity like a normal person.
Yes. Just I think the leg, as I mentioned before, the leg is swelling. But she still can run, can walk, and so on. I'm just curious lah, how the swelling happened.
Okay. Um, did she has tea-colored urine or no?
Okay, for the color, I asked her, but she said that the color is just uh like usual. But sometime at the this morning, I said and I asked again to confirm, but I I give her uh description on light yellow or dark, and she mentioned a little bit dark yellow.
Oh, dark yellow. Um, did she did you notice that her eyes become yellowish in color? There is jaundice.
Okay, for the color of the eyes, I think it's like normal white color, no yellow, yellowish.
Mm, did you notice and there is a changes in her weight? If there is a weight gain.
Okay, as far as know, for my child, for this previous day, I do not know the exact weight for her, so I'm not sure about the weight gain or weight loss. But she just has a poor appetite.
Okay. Uh, do you have any family members with kidney problem?
Okay, for the kidney problem, for my family, I don't think so. No, and no history. But for my husband, I think there is no history for kidney problem.
Uh, is there any family members with autoimmune disease such as systemic lupus erythematosus, SLE?
Okay, for the I do not ever hear about the autoimmune disease before running in our family.
Oh, okay.
Yes, I just having a hypertension, and my husband having a gouty arthritis.
Uh, do you have any family members with a heart problem?
Okay, for the heart problem, I did not sure for my in-laws, but for my family, there is no heart problem in the family, in my family.
Mm, and then so did she has vomiting, diarrhea?
Okay, okay. For the vomiting diarrhea, there is no complaint by her, and no.
Did she has headache or seizures before?
No, there's no headache and seizure before.
Mm, so for the I will proceed with birth history. So when you during your pregnancy, do you have any
Okay.
problem?
During my pregnancy, I just diagnosed having a hypertension. Otherwise there is no other disease.
Um, and then did you deliver her through normal delivery?
I deliver her by a C-section.
Okay. What
Okay.
is her birth weight?
As I remember, it's around 3.7 kg.
Do you have any complication during the birth?
I think there's no problem, any complication because it's just fine. I'm just
Oh,
fine.
okay. Did she has any jaundice?
For the baby, I think on the fifth day, the baby has a jaundice and has a phototherapy for 1 day.
Okay. For the feeding, Did she has what milk? She breastfed or on formula milk when she was a baby?
Okay. As I breastfeed her about until 6 months, and after that I mix with the formula milk up to 2 years. Uh, and weaning start at 6 months. I mix with the porridge, and currently she having a regular milk 3 times per day. As for dinner, having a chicken, fish, and rice.
Mm, right now, she can eat everything, right? So,
Yeah.
uh, she is a picky eaters.
No.
Mm, so about her development, is it normal?
As to as uh, I see from her, and I think she can walk like a usual person, like around at her age. She can kick, dance. I think she's like a normal
Mm,
child.
okay. So, what is her current weight?
For the current weight, for the current weight, she is 19.6 kg.
What is her height?
For the height, okay, for the height is 109 centimeter.
9 centimeter.
I think that's a normal
Mm,
child around at her age.
okay. So, for the past medical history, did she has been diagnosed with any medical problem before?
Okay, this is the second hospitalization, as the
Oh,
first one is because of the lung infection, I think.
uh,
Uh,
at what age that she has lung infection?
I can't remember. That's all. Maybe
Uh,
in the little one.
so before this, she do not have any medical illness.
No,
Uh,
no.
okay. So this is the second hospitalization after the lung infection.
Yes.
Okay. Um, for the lung infection, what symptom that she presented with during the lung infection?
Oh, I can't remember well. Maybe, maybe, I can remember well. Sorry for that.
Okay. Mm. And then for did she is on any medication?
She no,
No.
no any indication right now.
Did she has any drug allergy or food allergy?
Okay. For the allergy, no, she has no allergy.
Okay. Did she has have complete the immunization? The
Yes. As she is now is 5 years old. I just follow the health ministry the guideline for the immunization.
okay. So what is your age? Your
Okay. My age is 42 years old,
hmm,
and for my husband is 50 years old.
50 years old. So do you have any disease?
Okay, as I mentioned before, I'm having a hypertension, and now currently I'm taking a medication called amlodipine, something like that.
Okay. The father is healthy or not?
Okay, as I mentioned previous,
Oh,
the father having a gouty arthritis.
okay. Mm, so, uh, do you what is your occupation?
Okay, for now I work at the public assistant at health department at Kuantan. For my husband work at the government. Uh,
Uh,
right.
so, what is your family income in a month?
Okay, in a month around 5,000.
Where do you live?
I live at the Bukit Go, Kuantan.
Bukit Go Kuantan. Okay. So is it terrace house or uh,
Terrace house.
uh, your house has a good electric and water supply?
Yes.
Okay. Uh, I think that's all.
Okay.
So,
Okay.
Thank you, mashallah. Good ladies. So now asking Dr. Salwa, can you make summary in few sentences?
2 sentences. Okay, so uh, Isha, 5 years old girl, presented to emergency department of swelling the of the of the face and leg for 3 days duration, and it is associated with frothy urine, reduce in frequency, and reduce in urine output, and also ascites, as swelling of the abdomen.
Okay. So what is your working diagnosis?
My working diagnosis is nephrotic syndrome.
Other
Because
differential diagnosis? Yes, yes, but it's very important.
sorry doctor, I cannot hear you clearly.
But it's very important. Yes.
Okay,
Nephrotic syndrome, but what?
but what?
Yes.
The causes or
Other differential diagnosis, please.
other so other differential diagnosis, maybe uh congenital heart disease, uh maybe liver, chronic liver disease, or allergic reaction, and also protein losing enteropathy, due to malnutrition.
Okay. So about the kidney itself, good that you know the other differential diagnosis in
Um,
other organs.
the henoch Shaolin purpura HSP,
What else?
and then post streptococcus acute glomerulonephritis,
Yes. What else?
um, urinary tract infection,
Okay. What else?
um, IgA membranonephropathy.
Good. What else?
What else?
Can be organ failure.
Okay.
Can be acute organ failure.
Acute organ failure. Uh,
AKI.
Acute kidney injury.
Okay. So how can you prove your diagnosis as nephrotic?
We do uh, the urinalysis to look evidence of proteinuria,
Okay.
and then we do 24
But sorry,
hour
sorry.
urine protein.
Okay.
Um,
How to measure it?
of the measure.
How to measure the urine protein? What is the normal?
So no, I'm not sure.
Who can answer?
Maybe 40 milligram, less than 40 milligram.
Bear. Per day.
Per hour, per hour.
So it is very, very important. So less than 40
Milligram per hour.
per hour. Okay. There is another way to collect either random sample or to use very important ratio, which is
Is it albumin?
yes, albumin to
Uh,
creatinine ratio in the urine. It is very important, Salwa. Albumin to creatinine ratio is
Yes.
very important. It's
Yes.
normal, must be
25 and above.
no.
Mm,
Okay, so now we must know the normal. I said to know the abnormal, yes. So this is an important point you need to handle it. What is the normal protein secretion per hour per day when I am going to set is it proteinuria or not? If I collect for 24 hour, how much I suspect the upper limit, okay? And the other thing, other measures which can be albumin to creatinine ratio or protein to creatinine ratio inside the urine, okay? What other investigation to confirm the nephrotic?
I would like to do ASOT titer to exclude post-streptococcus glomerulonephritis.
Let us now concentrate. You said your top diagnosis is
Oh,
nephrotic.
okay.
Yes.
Nephrotic.
Yes.
So
What if you ask it question like that? You must ask yourself what is the criteria of diagnosis of nephrotic. It will let your mind aware. So what is the criteria?
so look for the hypercholesterolemia.
Okay. What else?
Edema.
Yes. What else? Hypoalbuminemia.
Albuminemia.
You must check the liver function test looking for the albumin, protein, and cholesterol and the other lipid profile. It is very important, okay? Because that's criteria of nephrotic syndrome. It must be very clear with every one of us. It is 4 criteria. I must search for that. Okay, what other investigation do you need to consider for nephrotic syndrome?
Serum complement level.
To what did you suspect?
For complement.
Yes.
Complement will be low because of proteinuria.
Are you sure?
Yes.
In nephrotic syndrome, complement will be low?
Yes, C3.
Who has another suggestion? So what will happen in case of nephritis, glomerulonephritis?
C3 level will low.
And the C4 normal.
Yes.
So this is criteria for glomerulonephritis, not for nephrotic. is an important test to rule out nephritis, or sometimes there is looks like mixed picture of nephritic. Okay. In other investigation, we said according to the criteria, we consider the urine. We didn't finish the urine, but in the urine we are checking the amount of proteinuria, but also if you are thinking by the same way, we would like to exclude any hematuria or RBC casts, because casts will guide you. Okay, in case of nephrotic, you may find certain cast. In case of nephritic, it will be RBC cast. So it is very important to know the casts which we can see normally and what is abnormal and how it can help me. Of course, to search for UTI is an original thing. Okay. What other investigation do you need to consider in nephrotic, Salwa?
I would suggest anti-nuclear antibody.
When
to
you suggest it for every patient? It is a good suggestion.
ESR. After doing ESR, and then there's to rule out the SLE.
Okay, so if there is any susceptibility to be secondary, like the patient has a malar rash, he has family history of SLE, he has another criteria, you know that SLE is 11 criteria. Okay, if you can go for even serially, you must suspect SLE. Okay, so it is very important if suspected. So medicine is something also need you to be a bit diplomatic in presenting yourself. Okay, if I am suspecting nephrotic syndrome, I'm going for blah 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 blah, but to rule out other diseases, like if this nephrotic syndrome considered secondary nephrotic syndrome, so I may consider SLE according to the history of the family and the clinical presentation. I may need to ask for double-stranded DNA. Okay, but here an important question: what is the causes of secondary nephrotic syndrome? And this is very important. Ayman.
Secondary causes may include SLE.
Okay. Some infection is very important, like HIV, hepatitis. Okay. Some drugs can cause penicillamine like that. So we must know. That will bring us back also to the importance of history. Okay. So, and it gives us an important lesson always to think about is that disease is primary or secondary. Okay, as I told you before, we must check for any disease, is it primary or secondary, and it has any complication or not. So other complication, other investigation, Dr. Salwa?
Can we do renal profile?
Yes, very important.
Yes.
Very important. If you are dealing with any organ, don't forget to check, is it working or not working nicely? Okay, Rahmkumullah. So it is very important. Very important to do BUSCE, blood urea, serum electrolyte. We did already the lipid profile. What other investigations?
Full blood count.
Yes, it's very important. Searching for what?
For anemia due to microscopic hematuria. And then to rule out infection.
Okay, good. What else? So we are looking for all parameters of the full blood count. I spoke to you before to prepare how to read full blood picture. Did you finish it?
For the platelet, if there is thrombocytopenia.
Okay, that's a good. So if this is nephrotic syndrome, what complication you are suspected to happen?
What doctor?
Complication of nephrotic syndrome.
Chronic kidney disease.
Okay. Chronic or acute? Acute or chronic kidney injury. Okay. What else?
Mm,
Farah?
pleural effusion.
So fluid overload.
Overload.
Fluid overload. Okay. Farah, what other complication of nephrotic? Shaira, are you around?
No, the Farah Shaira is pitch assistant.
Oh, this is our Farah.
Yeah.
Okay. Okay. So Aliyah, other complication of nephrotic?
Maybe hypovolemic shock.
Okay, very important. How come he has edema and can go choke? How? What is the meaning of edema?
Decrease oncotic pressure, and there is accumulation of fluid at the extravascular
Yeah, that's why.
space.
So the child has a lot of fluid, but at the same time he can be presented by shock. And this put any doctor, he must know the mechanism of the disease. Okay, how to be very cautious during the fluid resuscitation, and don't the child go for irreversible shock. So you will find your medicine with time. I used it to say it is not straightforward. It is not 1 + 1 = 2. No, you must be very cautious. Don't be reading the book and try to take decision from that. Every patient has its own evaluation and its own progress. Okay, so sometimes we need to give diuretic to decrease the fluid overload. At the same time, we are giving fluid for increase the intravascular. So we are going also to give albumin to allow it to get the fluid from the interstitial one. That's why how to know the mechanism of any disease will help you to manage it by the correct way. Other complication, Fatin?
Infection.
Infection. Why infection happen? Yes, this is a very common. Why it happens?
Because of low immunity.
Why? Yeah, we are considering them as bit immune compromised, okay, or incompetent. Why? Who can answer?
Maybe as the patient is hypoalbuminemia,
Yeah.
so reduce the immunoglobulin.
Okay, so is losing the
So
protein, including immunity part inside the urine. Good.
Long look steroid usage.
Yes, steroid usage can use, but at this situation, no. Usually, steroid will help resolution of the original autoimmune. So it is very beneficial, but sometimes we can expect that any edematous tissue is susceptible for infection. Okay, so we must know what is the mechanism of disease, please. So it will help us how to manage. Can we see some OSCE, Dr. Nabila?
Alia, we cannot hear you.
Okay, sorry.
Okay.
Okay, all of you can see the slide. All of you can see.
Yes.
Yes.
Okay. As the first slide, okay, at the left side, okay. Okay, what is the picture means for you? Anyone can answer? At your left. Okay, what is
Uh,
it?
Bilateral periorbital swelling.
Okay, good. Okay, for the right picture. Anyone? Anyone? It seems like left, but the left is at the right is more prominent for the facial puffiness. Okay, you can see the whole face is puff. Okay, so this two sign is important in the nephrotic syndrome. Okay, for the second slide, okay, anyone can answer the condition of this child?
Ascites.
Ideals.
Okay, good. As you can see, the abdomen is distended, and the differential diagnosis for abdomen distended is nephrotic syndrome. Other than nephrotic syndrome, what is the differential diagnosis?
Chronic liver disease.
Okay, another other one?
Congestive heart
Okay,
failure.
good. Yes. Okay. So okay, the important part I want to show is this picture. Anyone can know the disease, the condition?
Pitting edema.
Okay, bilateral PT
Pitting
leg
edema.
edema. Okay. So this as I show the sign. So this nephrotic syndrome has this sign. Is really prominent for the child to have. Okay. Next, for this nephrotic syndrome, we need to do the important part is the investigation by the bedside examination, and we do the what you know about this picture. Urine dip.
Urine
Urine
dipstick.
dipstick.
Yes, urine dipstick test. Okay, it is important for the mom to always do this test to know whether the urine having a proteinuria. You can see the right side, the protein at the 1, 2, 3, 4, 5, the fifth one, there is a protein. So if the positive, you can see the green. Okay, 3 positive or what? Positive. So from this urine dip test, we can see the proteinuria and also the bilirubin. Okay. Okay, I think that's all from me. Okay.
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 So if you are searching for edema, now we can see the face and the eyes and abdomen and the leg. What other area do we need to check for edema?
How about the sacral? Sacral
Okay.
edema.
Sacral. What other?
Genital area.
Genital,
Scrotal.
scrotal or labial. Very important because it will give you a guide about the severity. What other area? Very important.
VI.
You put it in your. What is BI?
Respiratory.
Yes,
Yes.
the chest. So very important to check for either pleural effusion, which will be stony dullness, or pulmonary edema, which will be fine crepes. Okay, now you need to polish your knowledge about nephrotic syndrome by coming back to your reference. You must know how to differential diagnose edema how we differential diagnose even nephrotic syndrome itself. Is it primary or secondary? Okay, how we can differential diagnose about the types of nephrotic syndrome. Is it steroid sensitive or steroid dependent or steroid resistance or frequent recurrence? All this is an important diagnosis. The most important test which Salwa doesn't said is the considering the kidney biopsy. If the patient doesn't respond to renal to steroid, okay, you must know what is the indication for biopsy, okay, and you must know how many types of nephrotic syndrome. If we did the test, we will find it is 5 types by microscopic examination. Okay, all this must be clear for you. We have in our pediatric protocol very nice chart for treatment of nephrotic syndrome. When we are going to introduce other immune modulating, I prefer here not to set chemotherapy. It is immune suppressive or immune modulating drugs, okay, like cyazabrim or cyclosporin or whatever. Must be said, don't set the family it is anti-carcinogenic drug or anti-malignant. No, we can use it as modulating our immune system. So it is very important, please, to consider all that. Consider also how to do a good communication with a patient with chronic problem like that, because he will be, looks like will be one of the figure of the family. They are happy if you did a good job and they feel with a good bond with you. So please make use of that to teach the family and give them hope and give them knowledge so they can counter with you. They can do a good job for the patient. Okay, very important logbook to write every details happening, to check for any complication. Okay, am I clear? Thank you for this first case. I think we can give you a minute if you need to ask any question, and then go for the second case. Okay. Okay, we can start with the second case, please.
Yes, doctor.
Okay, who will be?
I will be the father for the patient.
Okay.
And
Who will
want to
raise
be
his hand? Who will comment the Najmi histories?
Me.
Okay. So we have Fatin now. Okay. Who will present the Uski?
Trotsky.
Oh,
Oh no.
The slides in the Uski. Who will present after you, Najmi?
I thought there will be only one OSK.
Why? You asked me. I told you for all cases.
I'm misunderstood.
Oh no, is it missed or not? Okay. So you can start, but give the diagnosis to Alif Aini. He can present with us some pictures, please. Okay, Alif. Okay. Send the diagnosis only to Alif, and you can start. Oh, sorry, Najmi. Give the diagnosis to Alif to prepare some OSCE for you. and you can start now for 20 minutes.
Okay, wait.
Okay.
Hello. Can I start now?
Yeah, okay.
Okay. So what's bring you and your child here? Before that, I'm Fatin. I'm the third year of the medical student. So I would like to
Yes.
ask about your child. So what brings you and your child to the hospital?
So basically, I bring my child, my daughter, to the hospital because she has. I noticed that she had rapid breathing one day before.
Rapid breathing. So may I know what's your child's name and how old is she?
She is she, the name is Indah. She is 4 months old.
4 months old.
Mm.
Okay. So the rapid breathing, is this the first time?
Yes, it is the first time she had this kind of problem.
Okay, so it is sudden. Uh, can you describe the rapid breathing?
So basically, it happened 3 days before, where during that time, her mother after her mother bathed her, so her mother I mean my wife claimed that she my daughter have coughing after took the bus, the morning bus around 9 a.m. and then she coughed continuously until she became difficult to breathe. And also, my wife noticed there is some widening at her nostril,
Okay.
and then after the continuous cough, uh, my daughter have an episode of vomiting, but it is not. But there is but it just but the vomitus is consists of white and also milk, white clear milk, mucoid.
Is it after eating?
No, just after she had a continuous cough.
Okay. Is there any more?
And then after she vomit, then my wife noticed that her rapid breathing become rapid,
Worsen
become worsen.
So this rapid breathing happened 1 day or 3 days before?
Mm, the rapid the rapid breathing um the rapid breathing occur 1 day before.
1 day before. So before that 3 days cough.
Uh,
Is it? Okay.
yes. She also has a fever and also runny nose for the past 3 days.
So for 3 days she had cough, fever, runny nose,
Yes.
and then 1 day before you come here, she had rapid breathing. Is it
Yes.
correct? Okay.
Yes.
So does your child complete? Okay. Uh, you So I would like to ask about the fever. So
Mhm.
do you have any documented temperature?
No.
Okay. Did you seek for treatment 3 days before for the fever?
So for the fever, I just put the cooling gel patch on her forehead, and then the fever resolved.
Okay. So the fever is sudden, is it?
Yes.
Okay. Does it associated with the child's or with child's origo?
No, it's not associated with chest rigor.
Is there any sore throat?
So through no.
Okay. Does it affect your child's to feed?
To feed. Yes, because she not I noticed that she refused to feed before a night before the admission.
Okay.
Sometimes she tolerate, but with slow feeding rate.
So feeding rate. So before this, the feeding is normal.
Yes.
So the feeding right now become low or not at all.
So normally she would drink about uh 3 to 4 ounce milk,
Okay.
but I noticed that she hardly now she at that time she hardly finished 3 ounce milk.
Okay. This happened 3 days before, is it?
I'm sorry,
The feeding.
the feeding. Yes.
Okay. So is there does she complain any pain or
No,
she
she
cried a
didn't.
lot since she's only 4 months?
I think no.
No. Does she appear lethargy?
Hmm, I'm not sure, but I'm not sure about that.
Okay. How's dia punya activity ya? How's
Is
her
it?
activity?
Um,
Did
from
she
what
play
I
a lot? Okay.
from what I look, she can. I mean, like she can do uh, normal activity. For example, like can reach object. I mean, and sometimes she put object in her mouth.
Does she sleep a lot
Sleep
on
sleep a lot.
yes.
Yes.
She sleep a lot or
Um, I think yes.
but it's normal for her age lah. Okay. So no lethargy, okay. Uh for the cough,
Mm-hmm.
I would like to ask for the cough. So is it what is there any sputum?
No, just a dry cough.
Only dry cough. Okay.
Yes.
No blood?
No.
Okay. Sweet. So, do you notice any loss of weight?
I did not notice about any loss of weight.
Okay. Is there any cyanosis or any bluish at the peripheral?
No, there's no any bluish color.
Okay. Is there any swelling?
Swelling? No, there's
Is
no
there
any. Uh,
okay? Is there any nausea or vomiting?
yes, she vomit after the continuous cough.
Only one episode, right?
Yes.
Okay. Any diarrhea?
No, no diarrhea.
Okay. Is there any dysuria?
Dysuria. Mm,
Is there any problem in her urination?
oh, I think there's not any problem. With that.
There's no problem. Okay. Uh, is there any headache or
No, there's no any
is there any noisy breathing? Noisy breathing?
noisy breathing. No, there's no any.
Okay. I would like to ask about the past medical history. So is this the first time she admit to the hospital?
Actually, this is her second time
Okay.
going to hospital.
The first
The first time is around 2 months ago.
2 months ago. So what's her problem back then?
At that time, the doctor said that she had uh, upper respiratory infection, upper respiratory tract infection.
So does it resolve?
Um,
Okay, it recur again. Okay.
okay.
Okay. Um. So I would like to ask about the birth history.
Mm-hmm.
So for the birth history, uh, how did she deliver? How is she being delivered?
So she's delivered spontaneously, spontaneous delivery.
Okay. Is there any complication?
No, there's no any complication.
Is what's the birth weight?
If I'm not mistaken, the birth weight is around 3.3 kilogram.
Okay. So for before this, she doesn't have any illness, right?
Um, after after the birth, she had the uh, what we call it the yellowish discoloration
Okay.
of her skin.
After delivery.
Mm-hmm.
So neonatal jaundice. So does it resolve?
Uh, she was not admitted to the hospital. We
Okay.
just bring her to clinic for blood taking for around 1 week duration,
And then it's okay.
and then yes.
Okay. Um, I would like to ask about the immunization. So up to 4 months old, did she receive the complete immunization up to her age?
Yes, she's taken all the immunization up to her age.
Now, does she take any drugs?
Mm, no, she's not on any drugs.
Does she has any allergy? Any drug allergy or any food allergy?
No, she doesn't have any allergy to food or medication.
Okay. So I would like to ask about the feeding. So how's her feeding before to now?
So she was on both breast milk and also the formulated milk.
Okay.
And normally she drink about 3 to 4 ounce, but at that time, yeah, she hardly to finish 3 ounce per serving.
Okay. How about the growth?
The growth, I think she grow well. No, she grows normally.
Normal. Okay. How about the developmental milestone? Does it normal?
Yeah, she can roll over. She can uh, reach up for object and then sometimes put object into her mouth.
Okay. Now I would like to ask about the family history. So may I know how old are you right now?
I'm 41 year old.
Okay. How about your wife?
She's 35 years old.
Okay. There's do you is she the first child or she has any more sibling?
She is youngest out of three siblings.
Three sibling. May I know them all?
The first one, okay. The first one is mm, the first one has also history of the upper respiratory infection.
Is it boy or girl? And how old is he or she?
She
She. Okay.
she yeah.
How old?
All of them are girl.
Okay.
The first one is 13 years old,
Okay.
and then the second one is 11 years old.
Okay.
For the first one has a history of uh, upper respiratory infection, but for the second one, there's no any medical illness. She's well.
What do you mean by the first one? That she had a upper respiratory tract infection.
Um, uh, during during her, I cannot remember her age, but I can remember her age, but at the but she also had uh she also had a history of upper respiratory tract infection.
So, is it due to the hospitalization or she diagnosed it with any illness?
At that time, she had episode of runny nose and coughing.
Uh, when?
I can't remember her, but I can remember
Okay,
her
okay.
age.
So it's a long time ago.
Yes.
Okay. May I know you or and your wife, does you or your wife has any illness?
Yes, I have hypertension and
Okay.
diabetes mellitus.
Okay. How about your wife?
Um, no, she doesn't have any medical illness.
Okay. Is there any family history of cancer or any autoimmune disease?
No.
Okay. So may I know where you and your child live now?
Currently we live at the Kuantan.
Okay.
Uh,
Kuantan.
And near to our house, there is construction.
Okay.
Our house near to the construction site.
Okay. So how may I know your salary?
Mm,
Your job and your salary.
I am prison warden, and my wife is a housewife, and month for the income is around 5,000.
Okay, remaining 1 minute.
Okay. So I'd like to ask, is there any family history of asthma
No,
or cystic fibrosis?
I think no.
Okay. Is there any pets?
I'm sorry.
Any pet at home?
Oh, pets. No, we doesn't have it.
Okay, doctor.
Okay,
Thank you.
welcome.
You're welcome.
So can we come to the conclusion?
So we have Indah, 4 months old girl, was admitted to the hospital due to the rapid bleeding for 1 day, which associated with cough, nasal flaring, and worsen of
Okay.
difficulty in breathing for 3 days. Cough, nasal flaring, and vomiting, fever. So they okay. So the fever is associated with the runny nose, but no chills or rigor, sore throat. Okay, and there is no pain, and she refused. There is but she refused to eat, but no loss of weight. There's no lethargy, no swelling, or no UTI, and no sinuses.
Okay. So what is your working diagnosis?
So my working diagnosis, I think it is a bronchitis or bronchiolitis.
There is some voice coming. If someone can switch off the.
Najmi. Okay.
Okay, bronchiolitis. What is
Yes.
the rationale to say it is bronchiolitis?
So there is cough, fever, um, nasal flaring, congestion, and difficulty in feeding. And also there is difficulty in breathing and difficulty in feeding.
Uh, these symptoms are unique to bronchiolitis.
Yes,
Cannot be pneumonia.
I can. My differential diagnosis is also include pneumonia.
So why you started by bronchiolitis? That's my question from the start. Why you choose bronchiolitis other than pneumonia?
Okay, sorry, doctor.
Who can answer? She's right, but sometimes you are not able to present ourselves. Why it can be bronchiolitis?
Because of the congestion. He said that continuous after coughing, and then difficulty of breathing and the widening of the nostril.
You mean persistent coughing?
Yes.
And if this child said, oh, continuous for some time, is it bronchiolitis?
Not sure.
Noura Aisha, Siti Noura Aisha,
Yes, doctor.
she said my top diagnosis is bronchiolitis, and I agree. Why?
I think because of the age of the patient, usually bronchiolitis is a common respiratory disease in child between 1 to 6 months.
Yes, that's why common is common, but don't forget the second, the third, and the fourth
Okay, doctor.
diagnosis. Okay.
Okay.
So the age, because sometimes the bronchiolitis may be severe, need admission, and sometimes you need even mechanical ventilator. But its original cause is, what is the cause?
The viral.
Yes, what type, what viral?
Respiratory syncytial
Yeah,
virus.
this is the most common is RSV, but can be another virus like
Yeah.
influenza, some types of a lot of respiratory virus, even the coronavirus, we have a lot of benign coronas.
Okay.
Before we are diagnosing it by something known as RBB, R respiratory panel.
What?
Okay,
Respiratory?
respiratory panel. You just got swab from the nose, and they can do for about 30 microorganisms. Most of them are viruses, but they can add also mycoplasma and others. So it is very important. So number one can be bronchiolitis. Why? It is respiratory distress. So number one, you need to know what is the signs of respiratory distress in infant and older children, and how to define the severity. How can you diagnose bronchiolitis now?
It's the clinical picture.
Okay, number one,
And
clinical. Number two, investigations wise, what will be?
chest X-ray.
Okay, what you did, looking for what in chest X-ray?
Any hyperinflation.
Very good. So can be hyperinflation and
Any collapse or consolidation.
okay, so X-ray will help us to diagnose and put another differential diagnosis like mnemonic changes. Okay, sometimes it can guide you if there any complication or not. Okay, what else?
For the investigation, is it?
Yes.
We can do any pulse oximetry.
Okay, so this is known as bedside tests
Yeah, bedside test.
to define the severity of the
bronchiolitis.
distress.
The distress. Okay.
So number one, pulse oximeter. What did you suspect the pulse oximeter to be?
Reduce.
Sorry?
Reduce.
No, what is the normal?
98 and above.
98.
90.
You are very rich. So 95 and above. Okay.
Okay, sorry.
What is this pulse oximeter measure?
The oxygenated oxygen in the blood.
No. This is just a reflection of red light to measure that one. That's why sometimes it can be affected by if the patient has anemia or the patient has cyanosis, it can be affected. Okay.
Okay.
It's very important to know the simple knowledge about this pulse oximeter, I may send you one simple video, but it is very nice. Okay.
Okay.
This is number one. Other bedside test you can do.
ABG.
Very good. Looking for what? Always ask yourself if you are going to request any test, you must say why. Just for doing a test, just for wasting resources, or I am searching for important thing.
Is there any acidosis or alkalosis?
Okay.
The partial pressure of
Okay.
oxygen.
Partial pressure of oxygen became very low.
Yes.
So what does it mean?
Oxygen. The lung doesn't
Yeah, it means respiratory
distress.
failure.
Okay.
No, respiratory failure. Which type?
Type 2.
Hypoxia. Why hypoxia type 2? Respiratory, we have now oxygen only low. So it is respiratory failure type
1.
Type 1.
If CO2 started to be built and increased, it is type 2 now. So it is very important to with this blood gas to be able to know if there is system infection or not. Of course, if this child is 5 years and more, what important bedside test do you need to do?
Peak flow meter, is it?
Yes, very good. Spirometer or BEFR is a very important bedside test. So your colleague Fatin now presented an important issue to us, which is the importance of bedside tests.
Okay.
Here for respiratory, I did pulse oximeter, I did arterial blood gas, I make big expiratory flow meter. For convulsion, what is important bedside test? Is that
ECG.
dextrose.
Oh, dextrose.
Don't forget. Okay, hypoglycemia can cause unresponsive convulsion to medication. So you must diagnose it, and its treatment is straightforward. Give dextrose. Okay.
Okay.
So it's very important in every situation. We may need to do an important bedside test. Okay. Sorry, bedside test. It may be the first case, the patient now in the clinic, and we ask him for urine tests, UFME, urine culture, whatever. I just bedside test, I will get a look for the urine. If the urine looks clear, maybe frothy like that, but it is clear, usually can be nephrotic. If it is tea color or cola color, it will be glomerulonephritis. So many bedside tests can help you. That is will return us to be a good observer, to use all your sense to come to the diagnosis. What other investigation you may consider?
Any blood culture, CRP,
Okay, so if I suspected pneumonia,
FBC,
yeah, I may go for
blood culture.
septic investigation, which can be number one, the full blood count, of course, maybe differential count. How can differential count help me?
Is it viral or bacterial?
Yes, or other even mycoplasma atypical.
Yeah.
All this can be guided by that one. What other?
Culture, sputum.
What about CRP is very important.
Okay.
You must know how you are using the CRP and the other inflammatory marker. It is very important. Okay.
Okay.
Other differential diagnosis.
Pharyngitis.
Can be upper respiratory tract infection. Okay.
Okay.
But usually upper respiratory tract infection will cause like stridor like that. It is very important. Okay, laryngotracheobronchitis. Others?
Bronchiectasis.
Do you got any clue in the history for bronchiectasis?
No, no sputum.
Okay, so it is very important to rule pneumonia, which can be also viral pneumonia.
Yes.
Pneumonia can be viral or bacterial or aspiration or other organism. History of vaccination was very important. Why?
Because
Okay, let us give a simple scenario to Nur Aqila. If Nur Aqila, this patient has a family which is anti-vaccine and they refuse to give him any vaccine and they find this child is coughing for chronic cough. Do you know what is the meaning of chronic cough?
Cough more than 2 weeks.
Very good. Some said after 2 to 3 weeks it is persistent cough, after that chronic, but maybe consider after 2 weeks it is chronic. And this patient now has also some sweating, especially at night time, and his appetite is became very low. So what you will suspect?
TB.
Yes.
Pulmonary TB.
Yes, this is very important. No one is allowed to bypass the history of vaccination for two things. It will guide us if this patient came with severe upper respiratory tract infection and then propagated to be got like heart failure and anti-vaccine, we may consider diphtheria. So it is a lot of ideas can come to your mind. Number two, it is our responsibility. If the patient doesn't get any vaccine, you can try to convince the family again. So sorry, I know that your baby and you love him more than anyone in the world, but it is very important to give him the vaccine. It will protect him from killing or crippling disease. Did you need to see your baby with poliomyelitis, with another problem, with TB, with like that? All this disease, after we start the vaccines, it became very low. So you can start. It may be your guide this time may be accepted by the family. So you will reward twice. Reward from the baby, from the family, and from Allah even. It is very important to, at that time, you must know if the patient skips some vaccines, how can I make for him private schedule? It is very simple, but must be very constricted because if you are afraid he may disappear again, so we may give him a lot of vaccine in the first shot, try to protect him as much as we can. So the most important point is to go deep the history, and every piece of the history which we speak about, it is not wasting time. It is in the benefit of your scenario. It is in the benefit of your child. Okay, that's why. Another okay, now another differential diagnosis Fatin can be asthma.
Yes.
Can be.
Not likely, but we can. I think we can.
For months.
Oh no, but fever.
You are very strong to diagnose asthma at 4 months.
Yeah.
What? Even if 4 years, what? How can you predict
No.
asthma or not?
From the family history.
Yes, family history of
Asthma, but there's no.
Asthma only, or any other?
The atopy.
Yes, atopy either. So, what is the next system do you need to examine here, Nagiha? what is the next system do you need to examine?
The you mean in investigation?
If you suspect asthma, no.
Oh, okay.
Usually, if you are examining one system, you must ask yourself, did I need to extend my examination to another system or not?
Asthma.
Yeah. It is the who can answer. It is skin. Is it important?
Yes, because
Yes.
it can cause dermatitis.
Yes.
Eczema, dermatitis.
Eczema.
Don't forget, in every patient with respiratory problem to check is there any eczema or not. It will guide you. Okay. As
Okay.
one of the diagnostic, you must revise the API, asthma predictive index.
Okay.
Okay, it is very important. Can we start presenting the OSCE?
Ali,
Yes, Doctor, can.
Yes.
All right. So for the first diagram, can any one of you describe what kind of the condition that the baby had?
the pectus carinatum.
Pectus carinatum.
Eh,
Uh,
excavator.
I'm not sure, but I think it is a chest wall recession.
Yeah.
Is it?
If it is alone in the center only, you will go for Pectus excavatum, not carinatum.
Okay, sorry.
But if it is extended, so you are now thinking about
I would think chest wall recession.
it looks like Harrison sulci,
Yes, circles.
which means chronic chest recession. Okay, if I have just acute recession, it will be just either subcostal, intercostal, or suprasternal. Okay, but if it is chronic, it can cause like something known as Harrison sulci.
Which
Okay,
part?
this one over the liver, it makes even the liver and the spleen, the last lips from front side looks like bulged, but really they are the one who is depressed.
Okay.
Do you have any comment, Ayman?
Me,
Yes.
I don't have.
Okay. So it is a very important point for us is try to look for the chest from the sides of the patient to see his chest, is it expanded or not, or hyperinflated. We call it hyperinflated chest. Usually our chest looks like kidney shape. If it started to be hyperinflated, usually it means there is repeated attack of with the chest and hyperinflation. It will go with asthma. Besides that, I must get a look for any recession, either suprasternal, intercostal, subcostal. What about the sternum, sternum also? All this area is very important. Looking for the nose, looking for the tracheal tug, looking for head nodding, all this can be signs of recurrent respiratory infection. Okay, so remember that if barrel chest, usually we must rule out asthma. If barrel chest with clubbing, I must consider,
Chronic disease.
yes, like cystic fibrosis, bronchiectasis, like cystic fibrosis and the other. Okay. Second slide.
Right. So the second picture shows X-ray of the patient
Yeah.
with
I
vasculitis.
need anyone need to comment, please.
Can anyone of you describe the X-ray? Hello, anyone?
Yalla, anyone start and I will be supporting him. Mustafa.
Okay, from what I see, there is a hyperinflation of the lung
Very good.
because of the
So,
number of ribs.
because of what?
First, the number of ribs.
How much is it?
More
So
than
try to be patient to enumerate it.
9.
9 plus nearly 10.
Nearly
Okay,
10,
very
yes.
good. Okay, what other signs which give you it is hyperinflation, Mustafa?
This one is, diaphragm tak flat. Then, horizontal rib cage.
Yes, horizontal ribs. Okay, what else?
And then, narrowed mediastinum, narrow ini.
Narrow mediastinum because the lung is compressing. Very good. What else? What about the copula of diaphragm?
I cannot see
Why?
until below because the picture is cut there, so I don't know.
No. Here is the copula. Here is the diaphragm. Here they are in the same level. Can you see?
yes.
Is it normal to find the right side is the same level of the left?
Oh, I see. Okay, no. Because
It's the liver.
supposedly there's a liver there.
Yeah, that is the thing which I need you, please, while you are starting your clinical journey, you are now sitting with us for around 1,000 a day, sometimes with beads, sometimes with other. Try to escape the issue of spot diagnosis by why that diagnosis. Okay, because sometimes when I invert the issue, even simple case Down syndrome, sometimes I try to save the time with the candidate and tell him the mother feel that her child looks down. Did you agree? So he look at yes, looks down, bro. Why? Looks down. He cannot sit, or he just got one or two pieces. Okay, so please try to go deep. You are dealing with two things: mortality and morbidity. Maybe the patient die because you are not enough, not knowledgeable, not professional to save him, or he may be complicated and got morbidity. Both of them very painful for you if it happened with any lovely one. So our responsibility now is to have clinical skills that can give the best care for the patient. Okay, that's your goal. Remember, every one patient you saw him, he may be your way to for Allah to accept you, to forgive you, for help you. Okay, every patient. I am said not one patient every month. Every patient, if you deal with him like that, you must give him the best. You must go deep with him. You must manage him, and then Allah may reward you. Okay, it is medicine is a job of easy to go either right or left, either to Jannah or the other side. So take care, please. You see, now Mustafa now can tell us that the chest looks hyperinflated, the lung is hyperinflated, also compressing the heart, and the ribs looks like transverse, the copula of diaphragm like. So all this is your job. Even you must start by reading this is X-ray of this person who is aged like that, at which time, everything is very important. Okay, can we see another Oski?
Uh, that's all that I followed.
Okay.
It-
Signs, other signs of respiratory distress, which we can see. is the nasal flaring or working ala nizai. It means the baby needs to increase air. So he is opening his ala nizai, they are calling it working ala nizai or nasal flaring. And it is very important sign of, you see, these two pictures. The baby is trying to put a lot of air through the nose. Another one is the grunting. What is grunting, Ayman? You will find the patient do. Mm, mm. So he's trying to keep the air inside the lung as much as he can. Okay? It means he has considerable respiratory distress. If this video can work of grunting, if you remember during our management of severe respiratory distress, we may give ventilation, mechanical ventilation. Okay, we call this grunting is auto beep.
Sorry, no?
Auto beep. The patient do for himself peak in respiratory and pressure, peak in the expiratory pressure. So it's doing as if you are giving him beep. So if you find that even if neonate, you must consider it, please. Grunting. The patient, instead of getting expiration easily, so he is trying to close the glottis and then he try to keep the air inside. So grunting is a very dangerous, okay, as a respiratory distress, especially in pneumonia. Respiratory system is one of the most easy and the most difficult if you are not going systematic with it. Okay, so you must examine the chest from front and back. And even for every patient, we are not accept one view. Even for heart, even for abdomen, for nervous system, you must examine at least two view to make sure that your comment is correct. Okay? If you examine from the front and you didn't find anything and you finished your exam and the examiner asked you, did you finish? You tell him yes. What you auscultate, really, I cannot appreciate any findings. Then he come back and ask you, did you examine the back? Oh, sorry. Is the most awful thing for in practicing medicine. Okay, try to decrease it in your practice, please. And when you auscultate the back, you will find a lot of things. Decrease air entry. There is bronchial breath sound. There is crepitation. Okay, so it will be, what is the diagnosis now?
Bronchiolitis.
No, why bronchiolitis?
Sorry, based on previous X-ray.
Not this patient. I am asking if you got one patient which you examine from front looks normal, from the back you examined, you will find in the lower lung decrease air entry, bronchial breathing, and crepitation. What is the diagnosis now?
Easy congestive heart failure.
It is not fine crepitation. And
Is it
he has bronchial breath sound. What is the meaning of bronchial breath sounds? Means the mnemonic changes. Okay, so now we have pneumonia, which we will call it at the time right lower basal pneumonia. I mean it is in the lower lobes. You can sometimes, if it is not so clear from front, you can only hear it from the back. That's why you must be very cautious. And the many basal pneumonia also can be presented by vomiting because it irritates the stomach. Sometimes it can be presented by vomiting and you are diagnosing the patient, doctor, yes, this patient has gastroenteritis, he has vomited 6 times, and go with me to the other area. Okay, that's why please try to polish your clinical skills. My simple comment, please always introduce yourself to the patient and smile to him and introduce yourself. And I am here to go to history from you, sir. Is it okay? Yes. And introduce and ask him what's about his details. Don't go directly. I know that we are making a mock situation. The age is very important. The sex is very important. The progress about all details about the history is very crucial, and you must be able to do it in a shorter time. This time you will find yourself sitting in the clinic and have a lot of patients. You don't have time to waste. If you make late with one patient, the other will be seen at the end. It is not like that. Okay. Thank you. Do you need to ask any questions?
No, doctor.
Is it clear now our two lessons today, please?
Yes.
Again, you must be systematized. Okay. Know what system you are examining and what is the possible diagnosis and the differential diagnosis, not to miss any important thing. And also, it is our job to know, is it primary disease or secondary disease, and is there any complication of that disease? Okay. Don't accept single diagnosis in your life. You must put what be the second or third diagnosis, because sometimes it may come to it. Okay. Every investigation you are going to ask, you must have rationale for that. And don't forget, please, the bedside test, which can help you for many cases. Okay. At the end, I hoping for you, inshallah, the best, and try to revise all these scenarios for the respiratory system and for edema. Okay.
Okay,
Thank
inshallah.
you, and see you again.
Thank you, doctor.
You are welcome.
Thank you, Doctor. Waalaikumsalam.
Waalaikumsalam.
Thank you, Doctor.
Assalamu alaikum.
Waalaikumsalam.